Hello again, my precious friends. So I've been thinking about weight loss. And for the purposes of this video, I must assume that when someone says weight loss, they're talking about fat loss. Because your body is made up of a whole bunch of different stuff. And you can lose weight by losing muscle mass, and that's called sarcopenia, and that's not a good thing. Or you could be losing somehow the capacity to keep appropriate levels of water in your system, and that's called diuresis or dehydration, and that's not necessarily a good thing either. So we're gonna, if I say weight loss rather, you can assume that I mean fat loss. And some of you who may have begun a ketogenic or carnivore diet may be seeing excess fat fall away pretty quickly. And others of you may not be seeing much change at all. And if you started a change in your way of eating for the purpose of losing fat, then that can be pretty frustrating. But I would like to ask you to consider sticking with it. A lot of people try keto and it doesn't work out, or carnivore, and it doesn't work out the way that it does for other people, and they get frustrated and they're like, oh, keto doesn't work for me, or carnivore hasn't worked for me, and they give up. I'd like to ask you to reconsider giving up. You'll recall how I talked about it takes a time for your body to transition from being a glucose dominant metabolism to a lipid dominant metabolism. Your body takes time to switch those pathways over. And also, the way I understand it is, if you've been eating a substandard or a suboptimal diet for some time, you've likely accumulated a great deal of what I like to call micro-injuries or metabolic injuries. Your body isn't functioning as well as it could because of the detriments from the suboptimal diet. And as it takes time for your body to switch over to a lipid dominant metabolism, it also takes time for your body to heal all these little micro injuries. Your body might not effectively be able to switch fully into a lipid dominant metabolism until these micro injuries have been addressed. This is a possibility. So you have no way of ordering your body to, prioritize fat loss. Your body's going to prioritize what's the most important. Your body's going to prioritize what is holding it back from optimal function the most. And if you don't have a great deal of excess weight, I'm saying if you're less than, say, 25 or 30% over your optimal body weight, you might not see a lot of weight loss to begin with, because your body's prioritizing different things. And I understand that's frustrating, but please don't give up. Even if you never lose any more fat, which is unlikely, but even if you never lose any more fat, your life will be better. Your mental state will be better. Your overall health will be better. If you have chronic pain, your chronic pain will get better. If you have autoimmune disorders, your autoimmune will get better. And once your body has had time with an optimal diet to restore every pathway, every process in your body to full health and optimum function, there is absolutely no reason to believe that at that point you will not find it relatively simple matter to lose the excess adiposity, the excess fat, right? So please, I just want to ask you to stick with it. Accept the place that your body is in, with the knowledge that you are in the process of getting to a better place. When I say accept where you're at, I don't mean just accept and be happy with being ill and disabled. That's not what I mean. What I mean is, here we are, this is where we are now, and we're on a journey. And we can't force the journey to happen faster than it will happen. All we can do is give ourselves the best fuel possible and treat ourselves in the best manner possible with regard to sleep and stress management and all those other things that involve self-care, and allow our bodies to heal from the inside out in the way your body needs to. All right, so please don't give up. Don't get discouraged. If you have any questions or you just want some encouragement, please hit me in the comments. I will respond to everyone that I possibly can. Stay the course. You will get better. And as I said before, even if you don't lose any weight, your life will be so much better that I'm guessing that if you have a positive attitude, your excess adiposity will bother you less and less and less as time goes on. For instance, take me. When I first started my journey, I weighed over 300 pounds. I now weigh 185. And I would like to get about 30 or 40 more pounds off optimally. And I have been stalled for quite a while. Part of that stall is because I haven't been as adherent as I could be. I have a very, very bad habit of trying to have it all. Trying to have my cake and shun it too, as I like to say. But I've been pretty adherent for the last little while. Not much has changed, except that I feel so much better. And my mental state is so much better. I've told you all how I suffered terribly from clinical depression for years and years and years. And then that was exacerbated by PTSD. And that was a simply miserable place to exist. So miserable that I could conceive of not existing at all. And yes, that means exactly what you think it means. But I'm at this point in my life, I have 35 or 40 pounds that I'd like to have off. But I know if that never happens, I can live this way. I can do whatever I want. I feel great. My doctor says I'm healthy. If I'm asking for any more, I have to be willing to accept the reality of where I'm at. And the reality of where I'm at is I need to keep feeding my body an optimal diet, regardless of whether or not my body turns into something that I would rather envision it to turn into. It's going to turn into what it's going to turn into. But the important thing is it's going to change because of increased health, not because of reduced adiposity. If that happens, that'll be awesome. But if it doesn't, you know what? I'm never going back. I'm never going to start eating heavy carbs again. I'm never going to go plant-based again. My diet for the rest of my life is going to be animal food centered. Okay? I want you to join me. I want you to join me on this journey to vibrancy. I want to see everybody looking back and saying, I'm not going back. Life is so much better now. I will never go back. I, personally, am never going back. If I can help you, drop me a question in the comments. I'll be happy to respond. And thank you again for joining Aunt Patty, the Carnivore Hippie. Like, share, subscribe, and I will see you next time. Peace, love, and meat. Bye-bye.